Hi everyone, welcome back to our last video of this week lecture. In this video, we will discuss on the complications of diabetes mellitus. Let's talk about the acute complication first, which is the hypoglycemia. Hypoglycemia is defined by either one of the following two conditions, which is the low plasma glucose level, which is less than 4.0 millimole per liter, or development of autonomic or neuroglycopenic symptoms in patients treated with insulin or in the oral anti-diabetic drugs such as sulfonylurea and meglitinides. The symptoms can be occur due to patients having the palpitations, tremor, anxiety, or sweating, a lot of sweat, hunger, and paresthesia. And sometimes it can cause the cognitive dysfunction, behavioral changes, psychomotor abnormalities, seizure, coma, brain damage, and also can lead to death. That's why the cognitive function can start deteriorate when the blood glucose level drop by 3 millimole per liter. So the cognitive function does not fully recover for at least 45 minutes after the hypo episode. Thus, we as a pharmacist need to educate diabetic patients, especially to those who are in the insulin therapy or take the sulfonylurea or metiglinate class of drugs to bring glucose tablets to prevent any incidence of hyperglycemia. Diabetic coma is another acute complication of diabetes mellitus. Diabetic ketoacidosis, or known as DKA, usually happens to type 1 diabetic patients which has absolute insulin deficiency. Meanwhile, hyperosmolar hyperglycemic state, or known as HHS, usually occur to the type 2 diabetic patient which develop relative insulin deficiency. The manifestation of DKA and HHS are almost similar between one and another. High glucose level in the bloodstream and absolute or unprecedented of insulin level inhibit the glucose uptake by the adipose tissue and the liver cells. Thus, these cells starve for energy. This event will lead to adipose tissue to break down the fat, or known as lipolysis, and the muscle tissue will break down the protein, or known as proteolysis. The glycerol will be converted to pyruvate, which is one of the important components in the Krebs cycle that will worsen the condition by increasing the level of glucose through the gluconeogenesis and glycogenolysis. High level of glucose will excreted out through urine, or also known as glycosuria. Glucose is osmotically active. Water will tend to follow, resulting in increase in the urinations, or also known as polyuria. High loss of water lead to dehydration or thirsty, and also known as polydipsia. That is why diabetic patients that develop DKA and HHS will manifest these symptoms, which is the increase of the frequent urinations and feeling thirsty. Meanwhile, the free fatty acid from the lipolysis will converted to ketone bodies through ketogenesis. Ketone bodies are important because it gives cell energy, but it also may increase the acidity of the blood. That is why patients with DKA has acetone smell breath and can be detected by checking the ketone level in the urine and also in the blood. This DKA and HHS must be treated immediately by fluid therapy, potassium replacement therapy, and the insulin therapy. Uncontrolled diabetes is very scary. If untreated, it can cause a major complication on the microvascular and macrovascular as stated here. Microvascular refer to blood vessel that has small size, and macrovascular is refer to any blood vessel that has large size. That's all for today. I hope that everyone are able to understand for this week topic. If you have any hesitation or any inquiries, please do not hesitate to ask me. Thanks everyone. See you in the next week.